meet you. So, I have your chart right here, and it says that you're just here for a physical examination. Okay, perfect. And I see you didn't write down the last time you had a physical checkup. Do you know when it was? No? Okay, that's totally fine. Yeah, don't worry about it. So let's get you settled in. Alright. So I just have a couple questions, and then once I ask the questions, we'll get on with the little tests. Usually when people come here, they get a little nervous, but you look healthy, you look great. I'm sure everything is working great. So I just have a couple questions. So, are you currently on any medication? Alright. And how long have you been taking that? Okay. Do you have any negative side effects from it? Okay. Partial insomnia. Okay. Yeah, I'll be asking you about your sleep today. How often do you exercise? Okay. Getting it out of the house. Yeah. Well, it's nice that it's warming up out here. You know, springtime is one of my favorite times, and it'll be summer here shortly, so I'm sure that you'll be going out more and just kind of just getting in nature. Yeah. Alright. And what are your eating habits? Okay. Yeah. Perfect. It's okay. Moderation is key. And are you currently on any, do you take any supplements? Okay. How many times a day do you take that? Okay. And do you currently, on average, how much do you smoke, drink? Do you do any drugs or? Yeah. Okay. Alright. And do you have any pain or discomfort anywhere? Sometimes. Okay. And where would you say the pain is, and when does it come up off, or at what part of the day does it arise more than at other times of the day? Like, sometimes people have pain that arises more at nighttime versus during the day. Okay. Alright, and what do you do for a living? Okay, cool. Do you like doing it? Sometimes. Yeah, there's pros and cons to just about everything. Yeah. Yeah, so if you're sitting more, it might cause pain in those areas, especially like the way that you're sitting, but you know, with the movement and breaks, it can help you release any muscle tension that kind of stores up when we sit, or if we work a desk job, it, you know, we can get a little stiff, and I just encourage some movement as much as you can, you know, even if you get up to go to the bathroom, just like stretching for a moment. Yeah, yeah. Alright. And how do you feel? Do you experience any anxiety or, you know, mental discomfort? Okay. Yeah. Just. Alright. And what would you say triggers this? There doesn't have to be a trigger either. Just, any patterns that you notice where it comes up more often. Alright. Okay. Yeah. Okay. Alright. And seen any, have you ever been to any counseling, or have you ever seen a therapist or anything? Yeah, no, it's totally normal. Everyone, or not everyone, but I think almost everyone should go see a therapist, or, just someone to talk to and just release, We're all human, and it doesn't mean anything's wrong if you go see a therapist or a counselor. To me, in my eyes, it's just like, people see life coaches and people see certain coaches for certain things. It's like a therapist, counselor can be a coach for your mental health and just a releasing mechanism. Yeah. Do you do any self-soothing activities like meditate or journal? Do you have any outlet for your creativity and expression? Okay, cool. Yeah, I love that. Alright. Perfect. I think it's really good to find things that, bring more light onto ourselves in the world, and just to do some things that will lift your spirits, and to never stop doing those. Yeah, alright. So, just... Okay, perfect. Let me get my gloves on and we will start the test. Would you like any hand sanitizer? Okay. Alright. I like, putting it on because it smells really good, and sometimes these gloves create weird feelings like latex can. You're not allergic to latex, right? Did I? Yeah. Oh, no, I didn't even ask. Do you have any allergies? I totally missed that. It is in my chart right here. Let me just see. Okay, do you have any allergies? Okay. Alright. Okay, perfect. So, no latex, but now I'm gonna change these gloves real quick. Because I will be touching your face and neck, and I just tight with them, so let's change that. Yeah, don't worry, we have endless amount of gloves here. So, I'm just going to start with getting your temperature, okay? Just look at me. This is a no-touch one, it's so nice. Okay. Perfect. 98.7. You're on fire. Okay. 27. And I'm gonna get your blood pressure, and then we'll get your heart rate, okay? Did the other nurse measure you for your weight and height? Okay, let me see if I have it in my chart, because this... Yeah, I did just type. Yeah. Okay, let me take these off for a moment. Just type with this hand. Alright, so... Okay, I see it right here. Perfect. Alright. Amazing. Let's get your blood pressure. So, do you prefer a certain arm for this? Doesn't matter which arm we do. This one. Okay. So, I'm just going to wrap this around your arm. Just like that. Okay. We'll keep it on there. Just going to squeeze it like this, so you'll feel it tighten up. That's completely normal. I'm gonna just get it. Yeah, it's definitely uncomfortable to some people, but it'll just be a moment. Yeah. Okay. just put it there for a moment. Okay, it's working. Okay, perfect. We'll let that sit for 1 second. And then I'm gonna listen to your heart. Yeah. Just breathe deeply a little bit. Longer exhales, and we'll see what it's at. Okay, I think it should be good now. Perfect. We can take it off. Just look at it. Good. Yeah, your heart rate's totally fine. Yeah, and your oxygen levels are great, so. Now I'm just going to listen to your heart. Yeah. Alright, let's take this. Okay. And I'm just gonna listen. I just want you to breathe in deeply for me, okay? So let's put it on your heart. I just want you to inhale slowly. Ready? Deep breaths. Exhale slowly. Good, good, good. Perfect. And I'm gonna get your rib down here. Just keep breathing normally. You can take some deep breaths if you'd like. Okay. Good. And let's listen to the other side. Just breathe. Good. It's always good to slow down breathing. Yeah, and I'm gonna get your back, okay? Just at the back of you, and I just want you to breathe deeply. Good, 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 good. Okay, perfect. Everything sounds great. Yeah. Did you know that one deep breath can reduce your heart rate right away? Like, just one deep breath slows it down. Yeah, it's crazy. Alright. Just gonna get. Alright, is perfect. Yeah, these things are a little tight on the ears because it, like, blocks out any sound to hear your heart and to hear your lungs. Okay, perfect. And now I'm just going to check your ears and your mouth. Ears and mouth and eyes. Actually, before we do that, let's just do a quick little knee reflex test. So, since you're already sitting down, I'm just gonna hit your knee and we'll see if it reflexes. Yeah. Okay. Okay, perfect. And let's try the other one. Oh yeah, maybe I'll get out of the way so you don't kick me. Alright, let's do this one. Perfect. Amazing. Alright. Okay, and I'm just going to be checking your throat first. So I just need you to open wide. I'm just gonna take a look in there. Open wide, open wide. Good. And can you say ah? Alright, perfect. It's looking good. Alright, and I'm gonna do a little eye test, okay? So I just want you to look at me. I'm gonna first see how your pupils dilate. So just look at me. Good, and perfect. Just keep looking at me. Good, and okay. Keep looking. Perfect. And will you follow this light for me? Just follow it. Good. Amazing. And perfect. Okay. We're gonna do another little eye test. Let's see, real quick. Just need to find my pen. Okay. Alright, perfect. I'm gonna do one more. This one is a higher frequency. It's a C. So same situation. Just tell me when you don't hear it, okay? Alright. You don't hear it? Okay, good. Alright. Perfect. Oh, and I didn't ask you, how is your sleep? It depends. Yeah. Okay. Do you take any melatonin or do you listen to anything to fall asleep? ASMR, yeah. Autonomous sensory meridian response. I am a big fan. Yeah, very relaxing. Alright. Okay, and that helps you fall asleep. Yeah, okay. I can recommend some supplements. Ashwagandha is a really good one for sleep, as well as L-theanine. So, do you mean to write these? Okay. Alright. So, L-theanine, ashwagandha, of course, the known melatonin. But if you want to go more natural, I really recommend ashwagandha and L-theanine. But there's also this drink called Some Sleep, and it has melatonin in it and L-theanine, as well as something called GABA. So drinking that, I use that because sometimes I have trouble sleeping. If you drink that, it can help you relax and fall asleep quicker, as well as stay asleep. Yeah, it's just Some Sleep. I'll refer it to you if you just, give me your email actually, and I can just send over the drink and the supplements. Okay. Yeah. Tuesday. Okay. Perfect. Alright, yeah, because sleep is really important. It affects our whole entire well-being, and it can help you, get more energy during the day. And also, if we don't get a full sleep cycle, it can affect our emotions as well. It can affect our thoughts, and, just our energy is very important. So, I do recommend those to you. And everything else looks great. Everything's looking perfect. You're healthy. And even though it can be hard sometimes, the mind and the emotions, I just really recommend, finding outlets that you can feel safe expressing yourself, and, finding people and things that you like to do and that bring you joy, and just continue to do that, okay? Alright. Well, it was so nice, taking care of you. I hope to see you again soon for your next physical